I became an endocrinologist a little bit out of self-interest. My parents have diabetes, and so there's an 80% risk of developing diabetes with two parents, and so I just kind of took an interest in it, partially for my parents, but also for my possible future of developing diabetes. A more educated patient will end up in more effective outcomes. So what I try and do is to be a counsel to my patient, and we come up with a decision together. It can be challenging if there's some denial towards diabetes. The first part of that is to sort of make sure that the situation has been explained to them, that they do have this diagnosis, and to empathize that it's very hard to actually feel like there's a problem. Diabetes, amongst other health conditions, are considered silent diseases. We see the complications of these conditions in the hospital, and we bring it back to the clinic to try and tell patients that, hey, this is something real, and although you're feeling fine now, we're here to try and prevent further problems later on. It's completely treatable. It's completely treatable. Endocrinology is going through a renaissance right now. So there are medications that can prevent heart attacks and strokes and also help people lose weight. New devices that sort of talk to continuous glucose monitoring devices that use sort of an algorithm or artificial intelligence to help treat diabetes. So there's been some breakthroughs in endocrine care, and I hope they continue. We're still not there yet, but it's quite an exciting time for endocrinology right now. The uniqueness of my personal touch is that I really try and strive to educate my patients in particular, so that way they can make the best decisions for themselves. Sort of understanding where my patients are coming from, educating them, and really coming down with a plan together, I think that ends up with the best health outcomes in the end of the day.